National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, a health expert here at nationalnutrition.ca. Mononucleosis is a type of infection that you can get from what we call Epstein Barr Virus, and in some cases they've even implicated a type of virus known as cytomegalovirus or CMV virus as being related to mononucleosis. Mononucleosis refers to an increase in white blood cell count that happens in response to the Epstein Barr virus, or as I mentioned in some cases to cytomegalovirus. Typically, mono is contracted through human saliva, which is typically why it's referred to as the kissing disease, and is actually most commonly contracted in the teenage years. And it's usually from contamination with saliva, either sharing food or drink with somebody who's infected, or of course, kissing them, in which case there's saliva transfer, and that's usually how it's contracted. So it's a rather low transmissibility. What that means is, if somebody has mono, you can be around them, just try not to share utensils with them, try not to share drinking cups with them. And of course, unless you want mono yourself, don't kiss them because that's how you're going to contract it. Mono is characterized by extreme fatigue, oftentimes in early stages of the disease. Once symptoms present, you can get a lot of enlarged lymph nodes, specifically around the neck. And one of the other major things that can happen with mono that can be, the more serious effect of the disease, which is what we call splenomegaly, or enlargement of the spleen. This can be problematic because the spleen, if it gets too large, can rupture, as well as it could also press on other organs, changing the function of them. So if you suspect, after some chronic fatigue, you may have mono, it's best to go in and get tested. Your doctor can run a blood count to see if you've got the elevated white blood cells, as well as they can actually test the antibodies against the virus. Now, why mono is important to understand is it can become chronic and it can actually be reactivated later in life. This is why it's important that we maintain our immune function, and even if we do contract Epstein Barr virus, it's important to try and really boost our viral immunity. So boost the part of our immune system that attacks that Epstein Barr virus, limits it, and prevents that reactivation of it later in life. So some things you can do to help with your viral immune system: ensure adequate zinc and selenium levels, as these nutrients can be involved in your immune system and the function of your viral immune system, as well as certain herbs such as elderberry and astragalus can also be very effective at improving your viral immune system and reducing the chances of contracting the disease. And then of course, if you do have it, some things that you can use to help reduce some of the pain, some of the fatigue that goes with it are ginseng, and another herb that I really like for this is lemon balm, as it's very soothing, very calming at a time when you don't feel great. Now, the fatigue, it will go away over time, but it can actually be a very persistent symptom. So even after the lymph nodes shrink, the spleen goes back to its normal size, the fatigue can persist for months. And sometimes to help manage that, we'll use herbs like ginseng and supplement with things like Carnitine Coenzyme Q10 to try and improve the efficiency of the body's energy systems to try and help alleviate some of that fatigue. So if you have mono or you know someone that has, I hope this video has been helpful for you or for them. Please share the video, subscribe to our channel. Any questions or comments you can post below, and always remember, knowledge is health.